we are diving deep into Naltrexone, a key player in the treatment of alcohol and opiate dependence. Whether you are a student, clinician, or someone curious about how this medication works, stay tuned. It is an anti craving agent. It is an anti craving agent. It is an anti craving agent. It is opioid receptor antagonist. Opioid receptor antagonist. Naltrexone, naltrexone is classified. Naltrexone is classified as a naltrexone is classified as a mu opioid receptor mu opioid receptor antagonist. Mu opioid receptor antagonist. Let's look at the FDA approved indications. Let's look at the FDA approved indications. These are these are alcohol dependence, alcohol dependence, alcohol dependence, opioid dependence, opioid dependence, and and blockade of blockade of effects of effects of exogenously 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 administered opioids administered administered opioids administered opioids. Let's talk about mechanism of action. Let's talk about mechanism of action. Three main opioid receptors are there. The main opioid receptors are there. These are these are mu opioid receptors, kappa opioid receptors, and lambda opioid receptors. In these, naltrexone blocks mu opioid receptor. Naltrexone blocks mu opioid receptors. By blocking mu opioid receptors, by blocking mu opioid receptors, by blocking mu opioid receptors and and modulation of opioid systems, modulation of opioid systems, modulation of opioid systems, modulation of opioid systems It reduces reinforcing effects of reduces reinforcing effects of alcohol and opiates. So it reduces reinforcing effects of alcohol and opiates. Opiates. So that so that it reduces the rewarding effects and cravings. So it reduces the rewarding effects of alcohol and opiates and cravings. So finally reduces alcohol and opioid consumption. Reduces alcohol and opioid consumption. So it maintains abstinence. Here is how it's usually given. Here is how it's usually given. The dosing. Recommended oral dose and recommended injection dose. Oral dose and injection. Oral dose and injection. Recommended oral dose is 50 mg daily. 50 mg daily. Or alternate dosing. One thing is daily dosing, second thing is alternate dosing. In alternate dosing, it should be given 100 mg on Monday, 100 mg on Wednesday, and 150 mg on Friday. 100 mg on Monday, 100 mg on Wednesday, and 150 mg on Friday in alternate dosing. That recommended injection dose is 380 mg every 4 weeks. Every 4 weeks intramuscularly into gluteal region. 30 mg in 4 weeks. The injection should be given into alternate buttocks. Should be refrigerated. Be refrigerated. Should be administered immediately after mixing. Immediately after mixing. But there is a catch. Before starting, the patient must be opioid free for 7 to 10 days. Opioid free for 7 to 10 days. 7 to 10 days. 7 to 10 days. Confirmed by urine screening test. Urine screening test or naloxone challenge test. Naloxone challenge test for opiates. Urine screening test or naloxone challenge test for opiates. Let's look into dosage forms. Let's look into dosage forms. Dosage forms. It is available in it is available in it is available in it is available in tablet form, oral solution, and intramuscular injection. Tablet is available in 25 mg, 50 mg, and 100 mg doses. Oral solution is available in 12 mg per 0.6 ml. 0.6 ml. IM injection is available in 380 mg, 380 mg per vial. 380 mg per vial. 380 mg per vial. So tablet is 25 mg, 50 mg, 100 mg. Oral solution 12 mg per 0.6 ml, and IM is 380 mg per vial. Better outcomes are seen in those abstinent at the start. Better outcomes are seen in those abstinent at the start. Combining with counseling or educational therapy improves success rates. A long-acting injection helps avoid daily pill burden and improves compliance. So long-acting injection helps avoid daily pill burden and improves compliance. Improves compliance. Let's talk about pharmacokinetics. Let's talk about pharmacokinetics. Elimination half-life of oral naltrexone is approximately 13 hours. 13 hours. Elimination half-life of naltrexone via injection is 5 to 10 days. 5 to 10 days. 5 to 10 days. Naltrexone can start Naltrexone can start working within a few days, but full benefits often appear after a few weeks. After a few weeks, if it's working, you will likely see reduced cravings, less alcohol or opioid use, and fewer lapses. If doesn't seem effective, consider evaluating other factors or augmenting with acamprosate, with acamprosate, or behavioral therapy, education, and supportive therapy also. Supportive. Let's talk about side effects. Let's talk about side effects. Blockade of mu opioid receptors. Blockade of mu opioid receptors. Blockade of mu opioid receptors causes side effects. Mu opioid receptor blockade causes side effects. These are common side effects. Common side effects, injection site reactions, common side effects, injection site reactions, injection site reactions, and serious side effects. And serious side effects. What are the common side effects? What are the common side effects? Nausea, vomiting, nausea, vomiting, decreased appetite, decreased appetite, dizziness, dizziness, dysphoria, dysphoria, and anxiety. And anxiety. Injection site reactions are pain, pain, tenderness, tenderness, pruritus, pruritus, induration, induration, swelling, swelling, erythema, 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 or bruising, erythema or bruising. What are the serious side effects? The serious side effects are hepatocellular injury, hepatocellular injury at high doses, hepatocellular injury at high doses. Right? Eosinophilic pneumonia. And eosinophilic pneumonia. Eosinophilic pneumonia. Severe injection site reactions, sometimes requiring surgery. Severe injection site reactions, sometimes requiring surgery. Surgery. Overdose leads to overdose leads to nausea, nausea, abdominal pain, abdominal pain, sedation, 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 dizziness, dizziness, dizziness. Sedation and apathy may occur in a small subset. Weight gain reported but not expected. If side effects are bothersome, either wait, reduce the dose, or discontinue. 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 Or switch to another agent. Switch to another agent. Switch to another agent is usually the way. There is no strong augmenting agent for side effects. Dose change or switching to another agent is usually the way. Let's talk about drug interactions. Let's talk about drug interactions. Naltrexone is Naltrexone is hepatically hepatically metabolized by hepatically metabolized by dihydrodiol dihydrodiol dehydrogenase engine. Dihydrodual dehydrogenase dehydrogenase engine. Not metabolized by cytochrome 450. So not metabolized by cytochrome 450. So it has fewer interactions than many psychiatric medications. But it can block opioid-based medications, including common ones like cough syrups, or painkillers, especially opioid analgesics, opioid analgesics. Concomitant administration with acamprosate, concomitant administration with acamprosate may increase plasma levels of acamprosate, may increase the plasma levels of acamprosate, but dose adjustment is not recommended. It increases the levels of acamprosate in plasma, but dose adjustment is not recommended. What are the contraindications? The contraindications. Contraindications include taking opioid analgesics currently, taking opioid analgesics, taking opioid analgesics, current to opioid use or withdrawal, current to opioid use or withdrawal, withdrawal, acute hepatitis or liver failure, acute hepatitis or liver failure, positive urine screening test, positive urine screening test, positive urine screening test, and failed naloxone challenge test, and failed naloxone challenge test, challenge test. And allergy to drug components, allergic to drug components like like polylactic co-glycoside and many other components of the diluent. Caution. Caution in special populations. In elderly may require lower doses. In elderly may require lower doses. In children and adolescents, safety not established. In children and adolescents, safety not established. Not established. In pregnant women, in pregnant women, not generally recommended. Not generally recommended. Recommended. Especially in the first trimester. Especially in the first trimester. First trimester. In breastfeeding mothers, in breastfeeding mothers, drugs enters drug enters milk. So consider bottle feeding or discontinue drug. In breastfeeding mothers, drug enters milk. So consider bottle feeding. Consider bottle feeding or discontinue drug. Discontinue the liver failure. It is contradicting liver failure. Let's wrap up with some clinical pearls. Naltrexone is a great choice for patients who are not ready for fully abstain but want to reduce drinking. See best results when combined with psychotherapy or support groups. For binge drinkers, this drug can reduce both the frequency and severity of drinking episodes. Long acting injection improves adherence, but patients must plan and be supervised. Thanks for joining me for this deep dive into naltrexone. If you found this helpful, hit like, subscribe, and share it with your classmates and colleagues. Let us know in the comments if you want me to cover disulfiram and nalmefene. Thank you for watching.